Hi, active Austinites. My name is Dr. Mary Arnold, and I'm the physical therapist here over at Natural Fit Therapy. I get asked questions regularly about what sciatica is, and a lot of my patients are really concerned if they've been given this diagnosis. So I wanted to come on and do a couple videos about sciatica. And what I'd like to focus on today in terms of it is go over the anatomy a little bit, start to understand where these structures are and what they actually do, as well as talk a little bit more about what sciatica is and maybe a little bit about what it isn't, and what symptoms might look like if somebody does have sciatica. So let's start with the anatomy. The sciatic nerve is the largest nerve in the human body, and it starts in our low back and in our sacral area. Smaller nerves come together at about the back side of our hip, and they form the sciatic nerve. The sciatic nerve then runs down the back side of our legs, all the way down to our feet, and it gives little branches of other nerves as it travels down the back of our leg. It is responsible for a lot of the motor function as well as the sensory input to our leg. So based on where it is and what it does, let's then move a little bit into what exactly sciatica is. Sciatica sounds big and scary, like it's this diagnosis of some kind of disease, and that's really not what sciatica is. Sciatica is a broad term given to people who are complaining about any kind of symptom that is running down one or maybe both of their legs. And those symptoms can be found in lots of different places. Sometimes people have symptoms that only go down to the back of their thigh. Sometimes people have symptoms that go all the way down to their feet. So sciatica is very, very broad and can mean lots of different things to different people. Sciatica could also include symptoms of pain down the legs. They could include burning sensations. They could include numbness, tingling, and maybe even muscle weakness, right? So a good physical therapy assessment and evaluation would be able to look at all of those things and maybe see what areas of the sciatic nerve are involved, as well as to what extent. Are we seeing some motor involvement where we're noticing some muscle weakness in some of those areas? Or is it a little bit more just on that sensory level and we've got pain and maybe some numbness and tingling? So a good physical therapy assessment would be able to determine all of that for us. And so what causes sciatica, right? That's the big question, is what exactly is going on that's causing this? Is there a multitude of different things that could be going on, right? We've got the nerves that start at our low back and sacrum and come all the way down the backside of the leg. So where I always like to start is start at the top of the nerve where it starts, and then do my assessment and work my way all the way down the leg to see maybe what areas are involved. Maybe there's some involvement at the low back area, whether it's some stiffness that's putting tension on that nerve. Maybe we do have some disc changes that are also putting tension on that nerve. And then looking at the hip, looking at the muscles that go down the back of the leg, checking the knee joint, checking the ankle joint, right? If we have weakness, joint stiffness, irritation of other structures anywhere down along where that nerve travels, that could be contributing to that nerve irritation, right? What sciatica isn't most of the time is not a whole bunch of damage to the nerve. I've found that most of my patients, their symptoms show me that more times than not, sciatica is their sciatic symptoms are associated more with just their nerve being upset and irritated. Nerves are, I like to kind of describe them as being similar to toddlers and 2-year-olds, right? Toddlers and two-year-olds are super happy and fun when everything is exactly as they need and want, but the minute that something is not exactly the way that it's supposed to be, we get the 2-year-old meltdown, right? And nerves are the exact same way. Nerves do not like to be tugged and yanked on. They don't like to be stretched, and they like to have enough room to move around and glide really, really well. And so if there's anything that's affecting that a lot of times is one of the major and primary causes of a lot of people's sciatic symptoms. Could there potentially be other things going on? Of course. And a good physical therapy assessment would be able to rule in or rule out maybe some of those like more serious pathologies, as well as maybe kind of give you some peace of mind and say, hey, this is more just a nerve irritation than anything else, right? That's the whole goal of a physical therapy evaluation, is to decide where exactly these symptoms are coming from and to what extent, as well as understanding what we can do to help move forward, or if there's any other medical intervention that needs to be done by the doctor or the medical team. So that's a little bit about sciatica to kind of get things started. Thank you so much for listening and watching this video. If you have any questions at all, please feel free to comment below, as well as maybe message us on Facebook. We'll get back to you as soon as possible. And if this does sound like something that you might be dealing with, physical therapy is usually the first line of defense for doing something about this. So please contact us through our website, and you can sign up for our free discovery session to sit down face-to-face with me or one of our other physical therapists and decide if physical therapy might be a good option to help address some of your sciatic nerve irritation issues. Thank you so much for your time. Until next time, keep moving, y'all. Talk to you later. Bye.